right atrium because the left ventricle, the walls of left ventricle are 3 times thicker than the walls of the right ventricle. The ventricles are the pumping or the distributing chambers, while the right and left atria are the receiving chamber. These are receiving the blood from the general circulation and from the pulmonary circulation. These are distributing or the pumping chamber, pumping in the lungs and pumping in the general body circulation. So the left ventricle has to face the great resistance. To overcome this resistance, the walls of the left ventricle are more thick to pump the blood more efficiently in whole body against gravity especially. So the walls of the right atrium are less thicker, and this is the site of the SA node, and the site of AV node is the lower part of interatrial septum, which is formed by the posterior wall of the right atrium. So this is the location of the AV node below the opening of the coronary sinus. So this is the right atrium, the fossa ovalis, opening of the coronary sinus. This is the opening of the inferior vena cava, and here is the location of the AV node. This chamber is the left atrium, and this is the appendage of left ventricle known as left auricle. This is receiving the pure or oxygenated blood from the lungs by 4 pulmonary veins, and this is pumping the blood or emptying the blood through the bicuspid or the mitral wall in the left ventricle. So the pumping of the blood or letting the blood flow in the left ventricle from the left atrium is through the mitral wall. The closing of the valves are making some musical sounds, lub, dub, lub, dub. Lub sound is formed by closure of the tricuspid wall and the mitral or bicuspid wall, and dub sound is produced by closure of the pulmonary and the aortic walls. So this is the general structure of the heart or the cardia. In my next lecture, I will talk about the blood supply and the conducting system of the heart and the vessels of the body, circulating the blood that is bringing away from the heart, arteries, and bringing back the blood towards the heart, that is the veins. But not always veins are bringing and arteries are taking away. There are some exceptions. I will talk in my next lecture.